Hi, I'm Jason Erickson, active isolated stretching therapist. Active isolated stretching is a method of therapy that's been developed by Aaron Mattis over the last 40-some years, and it's widely used around the world today. So I want to look at just a couple of stretches for the lower body that almost every AIS therapist should know. So first thing we're going to look at is going to be a stretch for the glutes and lower back a little bit. So Kelly's going to do a little hip flexion. Her knee is going to come up towards the same side shoulder. She's going to go as far as she can. I'm going to give her a little help. And she's going to come back all the way out of the stretch. As she brings up, she's going to exhale each time. And with every repetition, she'll probably be able to get a bit further, sometimes quite a lot further. Now I'm assisting here. I'm giving her just a little bit of extra help, not pushing real hard, but it's just enough to give her help getting a little further than she can get on her own. Now she's not holding any of these stretches for a real long time, maybe second and a half to 2 seconds. And that's the first stretch. Now Kelly can also do these without any help from an AIS therapist, so she can bring this up, she can help herself out, and you'll notice that she can go all the way back out on her own, so pretty easy to do. This is something that I found very helpful for a lot of my clients that have been having issues with their hips, their low backs, their legs, and so forth. Okay, so the first stretch, again, is that knee is coming up towards the same side shoulder and all the way back. So the second stretch now is we're going to take that leg, she's going to bring it up, and she's going to turn a little bit, about 45 degrees. The inside of her knee is going to come up towards this opposite shoulder. She's going to reach it up here, and I'm going to give her a little bit of help. And then she's going to release it all the way back down to the tabletop again. So again, up and turn and reaching up here. And with a little work, she'll be able to get it pretty much all the way up to her shoulder again. Again, very, very helpful for a wide range of hip and leg and lower back issues. Obviously, there's some other things that might need to be done in combination with this, sometimes before or after this. Coming back down again. All right, Kelly can do the same stretch for herself. She can bring it up, she can turn it, she can use one or both hands to assist. And again, she's working on bringing the inside of this knee up and again across towards that opposite shoulder. Practicing on her own, she might do 8 to 10 reps on each side. Now, if she's particularly tight or sore, she might just do a few reps on one side and then move on to the other side or to the next stretch. Good. So Kelly's going to bring her leg back down and she's going to turn onto her side. So this is going to be a stretch for the front of the hips. Obviously, if we were stretching the back side, we may want to also stretch the front. Sometimes it's more important to stretch the front before we stretch the back. Again, that's something that varies depending on a case-by-case basis. But Kelly is going to have a good anchor here on the side of the table. Her knee is forward. She's got a good anchor here to help stabilize her body. As her therapist, I'm going to stabilize her hip here with my hand, and I'm going to help support her knee here. Her knee is going to be bent a little bit. As she kicks back, she's going to fire her glutes and her hamstrings, which will help to inhibit and hopefully lengthen the tissues along the front of her hip. Okay, another thing she's going to do is she's exhaling, and tightening her belly to help stabilize her lower back as she's kicking back. So again, this is something we might do 8 to 10 times. We might do multiple sets. And this can be extremely helpful for a whole lot of different types of, again, back and hip and leg issues. I've also found this to be particularly helpful for a great many athletes. Now, while Kelly's here, she can also do this without any help from anybody else. And all she needs is some type of rope or belt or strap, something that's pretty solid, something that's not all stretchy and rubbery. And so a variety of different ways that she can do it, but what I find to be very helpful is to use something that you can put a loop in it so that she can have a good grip on her foot and ankle. And she's going to bring this up behind her head, and as she kicks back, she's going to pull on that strap. Now it's easier if I'm stabilizing her hip and her leg, but she can do it herself too. And as she kicks, the further back she kicks, the more this has to lengthen out. And you can see it's going to be a little harder for her to stabilize herself, but this is one way that she can practice this stretch herself at home. And she can go ahead and let that go of that again. So those are 3 stretches that pretty much every active isolated stretching therapist in the world knows how to do and can help you with, and of course that you can learn to do for yourself. If you would like to learn more about active isolated stretching, possibly take a class in it, please visit AISfitness.com and you can find a listing of classes and instructors that are able to teach you good AIS technique. Thanks so much for watching.